You know, people say to me, well, it's too complex to fix. And I think what they forget is it's complicated on purpose. The more complicated it is, the less you know. The less you know, the more we pay. I mean, if you want to see what this has delivered for us, just take a look at the number of non-physician workers in healthcare. There are 16 workers for every doctor in America, and half of those 16 workers have absolutely no clinical purpose. They never see a patient, they never touch a patient. And in that excessive hiring of all of these individuals to handle coding and to handle billing and to handle the sale of insurance, there's over 500,000 Americans alone that just sell health insurance. In all of that complexity, we see the waste that we're experiencing. And the bottom line is, the more complicated it is on that scale, the more people we hire, the less likely it is that we're going to get good outcomes with our patients.
How do you connect, or how do you compare what we have in the United States with what's going on in Canada? A lot of things are said about it. I'd like to hear your sense
That
of it.
is true, and a lot of misconceptions. For example, let me just give you a couple. It's said that Canadian doctors are fleeing south to work in the United States because American healthcare is better. The truth of the matter is that the flow is in the reverse direction. It is said that Canadian doctors make less than American doctors. In fact, on average, they make more than we have. It is said that their care doesn't involve any private insurance, when in fact, the national healthcare system that has been successful in Canada covers about 70% of costs. They have a thriving private insurance system, but it's just providing supplemental care. So on every scale, the Canadians have made compromises and have been doing it since World War II. But the important thing about the Canadian system and why it outperforms our own is that they began by asking a very simple question. They said to themselves, how can we make Canada and Canadians healthy? In the United States, we never asked that question.
We asked the question, from what I read in your book, how can we make medical care profitable?
That's right.
Which is a very different question.
Well, basically, after World War II, we said to ourselves, if we could only defeat disease the way we defeated the Nazis, then health would be left in its wake. So it was a fundamental misinterpretation of what health is. They felt that if you just conquer disease, if we war on cancer and we win, then everything will be just fine. They didn't take into consideration the fact that health requires also good housing, safe and secure neighborhoods, a clean environment, clean water, which, obviously after Flint, Michigan, maybe people realize now that if your environment's bad, your health's going to be bad as well. So America is the only country in the world where we spend more on the actual delivery of health services than on all other social determinants of health combined. In all other nations, they invest in all of these other things, and as a result, their citizens tend to be more healthy than our own.